When the light goes off, does the picture fade?
Yeah, let me know if that happens.
Okay.
The protesters are saying today that when the foreskin is amputated, based on a study in the British Journal of Urology, the Sorrell study, he found that the foreskin contains the 5 most sensitive areas of the penis, including something called the frenulum and the rigid band, that many, girl magazines, they will call it the male G-spot, and some men will say it's the male clit. And by amputating that, you're causing severe damage to the man's sexual function.
Well, I totally disagree with that. I believe the foreskin has very little sensitivity. I believe one of the reasons it's done routinely in the Jewish population is for hygienic reasons, and also because they know for centuries that it does not remove the highly sensitive. It's certainly not the G equivalent of the clitoris. There's absolutely no comparison. The clitoris is comparable with the glands of the penis.
Right. What they were saying is that actually the clitoris has its own foreskin that also contains sensory Meissner's corpuscles, and that the glands, in fact, only contains very deep pressure receptors. So the inner foreskin that's amputated is, in fact, the most sensitive part of the penis, and that's essentially ablated during the circumcision. And they claim that that greatly reduces the man's sexual pleasure and his ability to have, they say it reduces or eliminates 16 functions, that the head is no longer covered during non-sexual intercourse. During non-sexual times, like when you're walking around, and that the head becomes calloused, dried, and desensitized.
Well, I don't believe that, and I've seen many penises where the foreskin has been removed and there's certainly no calluses. It's my genuine belief that there are very few receptors, sensory receptors in the foreskin. I believe most of them are in the glands and in the body of the penis, which is, I'm pretty sure, why it's routinely done, as they say, in the Jewish faith. I think another reason, of course, is hygienic reasons. Sometimes when the foreskin is left in, then there is a greater chance of inflammation. However,
and Doctor, can I ask you a question?
Sure.
In the infant, could you describe the proper way of when a parent takes a newborn intact baby home, uncircumcised, how would you properly clean the boy's penis?
Right. Well, the child is usually put into the equivalent of a bathtub, so that the child is relaxed, and then the foreskin is pulled back gently, and then the base of the glands is cleaned with soap and water. So it's quite it should be a simple procedure. However, in some cases where we call phimosis, PHIMOS, it's necessary then to at least do a minimal circumcision so the skin can in fact
in the infant. The infant might need to be circumcised for a tight foreskin.
Absolutely, which is why very frequently it's done before the infant leaves the hospital.
Right. And I know many times there's a condition called congenital phimosis, and that's used, I know the insurance will pay for circumcisions for that reason. And that's essentially if the baby's born with the foreskin fused to the head of the penis.
Well, it's not so much that; it's the opening of the of the penis becomes very restricted by a very tight foreskin, so that it's impossible to pull back over the glands. In that case, it's necessary to do a circumcision to allow it to come back. A circumcision doesn't have to be the total prepuce. It can be the top part of the prepuce. That seems to be enough in many cases.
And
the light's off.
If you don't circumcise,
The light's off. The light is off.
Oh, it's still going.
Oh, okay.
If you don't circumcise a male in infancy, what would be the likelihood that he would need to be circumcised later in life? And how much more painful, because this is one of their big arguments, is it more painful to circumcise an infant because they say that they're cut without any anesthetic or very limited anesthetic? Do babies cry during circumcisions, or do they typically sleep?
Well, nowadays anesthetic is used, local anesthetic, And in the majority of cases, the babies do not cry. In the old days, they did cry because no local anesthetic was used. Now we often use a sucker, something for the baby to suck on, plus a local anesthetic around the base of the prepuce, and it's taken off relatively painlessly. In answer to your first question, it's harder the older the child. The procedure becomes more difficult, but it's certainly easier while the child is in hospital immediately post-delivery.
The anti-circumcision loony protesters were saying that they gave a whole bunch of reasons why it's worse to cut an infant, because the infant only has to lose 2 ounces of blood to die, that they don't check for bleeding diatheses before the infant is circumcised, that post-op, that none of the actual methods are completely effective all the time, and that afterwards the baby can't have narcotic pain relievers, Percocet, and that they are defecating and peeing on the wound constantly, and that's unhygienic and very painful.
Right, and that's totally untrue. First of all, there's very little bleeding, frequently no bleeding whatsoever during the circumcision, and now there is local anesthetic, and there should be minimal pain. So circumcision, although not wanted by everybody, in my case, I didn't want my son to have a circumcision, but he ended up having it 6 months later due to infection. So
did you pull back the foreskin frequently to clean it?
Yes, of course. But nevertheless, it still became infected and required a circumcision at a later date. So there is some reasoning to go ahead and circumcise at birth, but we try